My name is Arushi Gupta. I'm a fourth year medical student, and today we are going to talk about the arterial supply of the brain in relation to stroke. So, in general, the circulation of brain can be divided into anterior part and posterior part. The focus of our video today is going to be the anterior circulation. So before beginning, let's talk in general. So in general, the anterior circulation differs from the posterior circulation symptoms in the way that the symptoms appear on the contralateral side of the body. What do I mean by the contralateral side? So for example, if you have a stroke of the anterior circulation on the right side, the symptoms will appear on the left side of the body. Let's dive deep into what are the three main arteries of the anterior circulation. We have the ACA or the anterior cerebral artery, we have the MCA or the middle cerebral artery, and then we have the lenticulostriate artery. Let's talk about the anterior cerebral artery. So the anterior cerebral artery supplies the lower limbs. So if you have a stroke of the anterior cerebral artery on the right side, you can see deficits like the lower limbs on the left side of the body. Then comes the MCA. The MCA supplies the upper limbs more as compared to the lower limbs. But the differential feature for an MCA stroke is the presence of Wernicke's aphasia. Now, what do you mean by an aphasia? Aphasia is when you have problems speaking. So, a Wernicke's aphasia is when the person loses the ability to comprehend, that is given by the temporal lobe, but the speech is fluent, versus the other two kinds of aphasia, which are global and Broca's aphasia. Broca's aphasia is associated with the frontal lobe. Here, the person can comprehend, but the speech is not fluent. What does that mean? That means that the person realizes that what they are saying does not make any sense, which causes them to get irritated and frustrated. The next one is global aphasia. In global aphasia, you lose the power both to comprehend and to speak fluently. The last one is the lenticulostriate artery. The lenticulostriate artery supplies the internal capsule, and as we all know, internal capsule is where you have all the motor signals. So a lenticulostriate artery stroke or an internal capsule stroke is a pure motor stroke. That means you are only going to see motor symptoms, that means weakness, but no loss of sensations. Now, what do you think is the most common cause of a lenticulostriate artery stroke? Let's think about it. And it is hypertension, because as we can say that hypertension causes the blood vessels to get filled with plaque and atherosclerosis, and that causes the small thrombosis to occur in the vessels, which later goes on and forms something which causes this pure motor stroke of the internal capsule. So to summarize, we have the three arteries, the ACA, MCA and the lenticulostriate. The ACA causes the lower limb involvement or anything which is below the umbilicus. So if you have a ACA stroke, say on the right side, you lose the left lower limb. Then if it's an MCA, MCA is more of the upper limbs, but the differential, as we said, is a Wernicke's aphasia. And third one is the lenticulostriate artery, which causes a pure motor stroke. So this was all for this video. In the next video, we are going to talk about the posterior circulation and how it differs and what are the main arteries. Thank you.
Observerships, doodles, CVs, interviews, we help you match stronger. Contact me at connect@drsinghmd.com.